So you're hitting on another round of antibiotics for an ear infection. That's not medicine or treatment. That is lazy. Did you know that research shows that antibiotics actually only work 50% of the time for an ear infection? That means you're better off allowing your child's immune system to fight the infection on its own and only resorting to antibiotics if it's an absolute last resort. Most of the time, an ear infection will clear within 2 to 3 days. What we don't want to happen is that so much inflammation and fluid builds up behind the eardrum that we end up with a hole in what's called our tympanic membrane. That is when your eardrum ruptures. You can usually tell when this is going to happen because there is a lot of pain in the ear. In these cases, you certainly don't want to add anything like warmth or warm compresses, no hot showers, because that can make the inflammation worse. So where are these ear infections coming from to begin with? It kind of depends on the age of your child and their diet, believe it or not. Young children who are being bottle fed or even breastfed a lot of times can end up with ear infections because they're lying on their back, and that fluid can actually regurgitate up into their ear canal. If it's an older child who is eating solid foods, a lot of times it actually has to do with dairy. Now, I don't think dairy is the devil. I love dairy. I eat a lot of dairy, especially pregnant. It's one of the best ways that you can get tons of protein and fat and nutrients in your diet for yourself and for your children. But dairy is a mucus producer, and it can cause a lot of inflammation in a child's sinuses, especially if they are prone to that type of infection to begin with. Are there natural and holistic treatments that can improve our chances of our body fighting that ear infection on its own? Yes. Absolutely. But what we want to make sure is that we are truly addressing root cause. Just doing things like putting breast milk in the ear or garlic mullein drops are not going to be enough for a child who has chronic ear infections. In that case, we really want to look deeper. Is it something structural? Do they need their ear canals to be opened? Why were they collapsed to begin with? And then is it something that's being caused by diet, inflammation, GI dysbiosis? These are all the questions you should be asking. Children who have chronic ear infections in childhood are actually more prone to other diseases as an adult, including things like asthma and eczema and psoriasis. I'm Dr. Britnei Artz, your complete care pediatrician, and I'm a naturopathic doctor that helps you identify the root cause of your child's ailments so that you feel empowered to treat them on your own.